There is a conversation that millions of men need to have, and almost none of them are having. Not with their doctors, not with their partners, often not even with themselves. It is the conversation about what prostate problems are actually doing to their intimate lives, and what can realistically be done about it. Prostate issues are extraordinarily common. The statistics on this are genuinely striking. Benign prostatic hyperplasia, which is a non-cancerous enlargement of the prostate, affects a significant majority of men by the time they reach their 60s and 70s. Prostatitis, which is inflammation of the prostate, affects men of all ages and is one of the most common urological diagnoses in men under 50. Prostate cancer is the second most common cancer in men globally. And yet, despite how common these conditions are, the conversation about how they affect a man's sexual health, his intimate relationships, his confidence, and his sense of himself as a partner, that conversation almost never happens in the depth it deserves. Men are often told their prostate condition has been diagnosed. They are often told what treatment is recommended. They are sometimes warned about certain side effects in general terms. And then they go home and navigate the intimate consequences largely alone, without adequate information, without a framework for understanding what they're experiencing, and without guidance on what they can actually do about it. This video is going to change that. We're going to talk about how prostate problems actually affect sexual intimacy and function, what the medical realities of various conditions and treatments look like, what practical and evidence-based steps men can take to protect and restore their intimate lives, and how to finally have the kind of honest, productive conversation with a doctor that too many men delay for far too long. This is important information, and it deserves to be delivered with the directness and respect that every man watching this has earned by showing up for it. Let us start by understanding the prostate itself and why its health is so deeply connected to sexual function. The prostate is a small gland, roughly the size of a walnut in a healthy young adult, located just below the bladder and in front of the rectum. It surrounds the urethra, which is the tube that carries urine and semen out of the body. The prostate's primary function is to produce a significant portion of seminal fluid, the liquid that nourishes and transports sperm during ejaculation. Because of its location and its role in both urinary and reproductive function, the prostate is intimately connected to sexual experience in multiple ways. The nerves responsible for erectile function run alongside the prostate gland. The muscles and tissues of the pelvic floor, which play an essential role in both urinary control and sexual function, are directly adjacent to and affected by the prostate's condition. Ejaculation itself depends on healthy prostate function and the hormonal environment that governs prostate health, particularly the role of testosterone and its derivatives, is the same hormonal environment that governs libido and sexual response. This is why prostate problems so frequently produce sexual consequences. The gland sits at the center of a complex network of anatomy, nerve supply, hormonal regulation, and physiological function that all converge on a man's sexual experience. When the prostate is not healthy, the ripple effects are broad and real. Understanding this connection is the first step toward addressing it intelligently rather than simply enduring its consequences in silence. Let us go through the main prostate conditions and what each one does to sexual health specifically. Benign prostatic hyperplasia, most commonly referred to as BPH, is an age-related enlargement of the prostate that is not cancerous and not directly related to prostate cancer risk. As the prostate enlarges, it can compress the urethra, causing a range of urinary symptoms including frequent urination, urgency, weak urine stream, difficulty starting urination, and incomplete emptying of the bladder. These urinary symptoms are what most men associate with BPH, and they are often the primary focus of treatment. But BPH also affects sexual function in ways that receive far less attention. The same prostate enlargement that disrupts urinary flow can affect ejaculation. Ejaculatory dysfunction, including decreased ejaculate volume, changes in the force or sensation of ejaculation, and a condition called retrograde ejaculation, where semen travels backward into the bladder rather than forward out of the body, are all associated with BPH and with some of the medications used to treat it. Alpha blockers, which are a common class of medication prescribed for BPH to relax the muscles of the prostate and bladder neck, frequently cause ejaculatory dysfunction as a side effect. 5-alpha reductase inhibitors, another class of medication used for BPH, work by reducing the size of the prostate by blocking the conversion of testosterone to dihydrotestosterone. These medications can reduce libido, cause erectile difficulties, and affect ejaculatory function in some men. These are real, documented side effects that significantly affect quality of life and intimate relationships, and they deserve to be discussed openly between doctor and patient before treatment decisions are made. Erectile dysfunction is also more prevalent in men with BPH than in men without it, partly due to the condition itself affecting pelvic blood flow and nerve function, and partly due to the psychological effects of dealing with a chronic condition that affects bodily function and self-perception. Prostatitis is inflammation of the prostate that can be caused by bacterial infection, other infectious agents, or in many cases by mechanisms that are not fully understood. It is classified into several types, including acute bacterial prostatitis, chronic bacterial prostatitis, chronic prostatitis and chronic pelvic pain syndrome, and asymptomatic inflammatory prostatitis. The sexual consequences of prostatitis can be significant and are often deeply distressing for the men who experience them. Pain during or after ejaculation is one of the most commonly reported symptoms of chronic prostatitis and chronic pelvic pain syndrome. This can range from mild discomfort to severe pain that makes sexual activity a source of genuine dread rather than pleasure. Erectile dysfunction is frequently associated with chronic prostatitis, both as a direct physiological consequence of pelvic inflammation and as a psychological consequence of pain, anxiety, and the emotional burden of a chronic condition. Reduced libido is common in men with chronic prostatitis, driven by pain, by the psychological effects of dealing with a difficult chronic condition, and in some cases by the hormonal and neurological effects of ongoing inflammation. Anxiety around sexual activity develops naturally when sexual activity has become associated with pain, creating a cycle where anticipatory anxiety produces physical tension that worsens the experience. The impact of chronic prostatitis on intimate relationships can be profound. A man who experiences pain during ejaculation may begin avoiding sexual intimacy without fully explaining why to his partner. His partner may interpret the avoidance as rejection or loss of attraction. The resulting communication breakdown can create distance and conflict in the relationship on top of the physical suffering already present. This is a situation where honest communication between partners, ideally supported by professional guidance, is genuinely important. Prostate cancer and its treatment produce some of the most significant and most discussed sexual health consequences in men's health. Prostate cancer itself, depending on the stage and location, may not initially produce obvious sexual symptoms, but the treatments for prostate cancer almost universally affect sexual function to some degree. Radical prostatectomy, which is surgical removal of the prostate, carries a significant risk of erectile dysfunction due to the proximity of the erectile nerves to the prostate gland. Even with nerve-sparing surgical techniques, which have improved considerably in recent years, erectile dysfunction is a common outcome in the period following surgery. Many men do recover erectile function over time, particularly with appropriate medical support, but the timeline and degree of recovery vary considerably between individuals. Urinary incontinence is another consequence of prostatectomy that directly affects sexual confidence and intimacy. Radiation therapy for prostate cancer, including external beam radiation and brachytherapy, can cause erectile dysfunction through effects on the blood vessels and nerves of the pelvis. The onset of radiation-related erectile dysfunction is often more gradual than surgery-related dysfunction, developing over months to years following treatment. It can also cause bowel and urinary symptoms that affect comfort and confidence in intimate situations. Androgen deprivation therapy, also called hormone therapy, is used in various stages of prostate cancer treatment. It works by reducing testosterone levels in the body to limit the growth of testosterone-sensitive prostate cancer cells. The sexual consequences of androgen deprivation therapy are substantial. Libido typically drops significantly because testosterone is the primary driver of sexual desire in men. Erectile dysfunction is extremely common. Changes in body composition, energy levels, and mood can all affect how a man feels about himself and about intimacy. These effects can persist for the duration of treatment and sometimes beyond it. For men undergoing any prostate cancer treatment, the sexual health consequences are not secondary concerns. They are central to quality of life, to relationship health, and to psychological well-being during and after a deeply challenging medical experience. Now, let us talk about the pelvic floor, because this is an area that receives remarkably little attention in conversations about men's prostate health and intimacy, despite being critically important. The pelvic floor is a group of muscles, ligaments, and connective tissues that form the base of the pelvis. These structures support the bladder, bowel, and in men, the prostate and related sexual organs. The pelvic floor muscles are directly involved in urinary control, bowel function, erectile function, and ejaculation. When they are healthy, toned, and functioning well, they support all of these functions effectively. When they are weakened, overly tight, or dysfunctional due to surgery, radiation, chronic pelvic pain, or years of compensatory habits, the effects on urinary and sexual function can be significant. Pelvic floor physical therapy for men is a highly effective intervention that remains significantly underutilized because most men have never been told it exists or that it is relevant to them. A pelvic floor physical therapist who works with men can assess the specific nature of pelvic floor dysfunction present, whether it involves weakness, excessive tension, or coordination problems, and develop a targeted rehabilitation program. For men recovering from prostatectomy, pelvic floor rehabilitation has strong evidence for improving urinary continence recovery and supporting erectile function rehabilitation. For men with chronic prostatitis and pelvic pain, pelvic floor therapy addressing muscular tension and trigger points has evidence for reducing pain and improving sexual function. For men with BPH related to pelvic floor tension, appropriate pelvic floor work can help address the muscular component of symptoms. If you are dealing with any prostate-related condition and your doctor has not mentioned pelvic floor physical therapy, ask about it specifically. It is one of the most underutilized tools available and one of the most beneficial for the specific issues that prostate conditions produce. Now, let us discuss what lifestyle factors genuinely support prostate health and by extension sexual function, because this is an area where men have more agency than they are often told. Physical activity has a well-documented positive relationship with prostate health and sexual function. Regular aerobic exercise improves cardiovascular health, which is directly related to erectile function since erections depend on adequate blood flow. Exercise also reduces inflammation, supports healthy hormone levels, improves mood and psychological well-being, and is associated with reduced severity of BPH symptoms and reduced risk of prostate cancer progression. The evidence for exercise as a meaningful tool in managing prostate health is genuinely strong. The specific type of exercise matters less than consistency. Walking, swimming, cycling with an appropriate seat, resistance training, all of these contribute positively. Diet plays a meaningful role in prostate health, though it is important to be medically honest and avoid overstating the evidence for specific dietary interventions. A diet that is generally anti-inflammatory and supports cardiovascular health is broadly beneficial for prostate health and sexual function. This means emphasizing vegetables, particularly those in the cruciferous family, such as broccoli and cauliflower, fruits, whole grains, legumes, and healthy fats. It means reducing processed foods, excessive red meat consumption, and foods high in refined sugars. Adequate zinc, found in foods like pumpkin seeds, nuts, and legumes, is important for prostate function. Lycopene, found in tomatoes and other red fruits, has been associated in some research with prostate health benefits, though the evidence is not definitive. Specific foods and supplements are frequently marketed with strong claims about prostate health. Some, like saw palmetto for BPH symptoms, have mixed evidence that does not consistently show significant benefit in clinical trials despite widespread use. Others, like selenium and vitamin E in high doses, have actually shown potential harm in some studies. It is important to discuss any supplements you are considering with your doctor before adding them. Because the prostate health supplement market is large, the evidence behind it is often weak, and some supplements interact with medications or conditions in ways that matter. Sleep quality has a direct relationship with hormone production, inflammatory markers, and psychological well-being, all of which affect both prostate health and sexual function. Chronic sleep deprivation suppresses testosterone production, increases inflammatory markers, impairs cardiovascular function, and worsens mood and energy, all of which affect sexual desire and performance. Prioritizing adequate, quality sleep is a genuine health intervention, not just a comfort preference. Stress management is equally important. Chronic psychological stress produces sustained elevation of cortisol, which suppresses testosterone production, increases systemic inflammation, affects blood flow, and directly impairs sexual desire and function. The pelvic floor, which we discussed earlier, often holds significant tension in men who experience chronic stress, and that tension contributes directly to the pelvic pain and ejaculatory dysfunction associated with conditions like chronic prostatitis. Stress management practices, including regular physical activity, mindfulness and meditation, adequate sleep, meaningful social connection, therapy when needed, and reduction of unnecessary stressors where possible are all genuinely relevant to prostate health and sexual well-being. This is not soft advice. It is physiology. Alcohol consumption in excess is associated with reduced testosterone levels, impaired erectile function, and prostate irritation. Moderate or eliminated alcohol consumption is a meaningful lifestyle choice for men managing prostate conditions. Now, let us get to the section that may be the most practically important in this entire video: how to talk to your doctor about prostate problems and intimacy. Because here is the reality. Most men do not bring up the sexual consequences of their prostate conditions with their doctors. They mention the urinary symptoms because those are hard to ignore. But the changes to their sex life, their ejaculatory function, their libido, their erectile confidence, those often go unmentioned. Sometimes because of embarrassment. Sometimes because they assume nothing can be done. Sometimes because the doctor does not ask and the man does not volunteer. This silence has real costs. There are treatments, interventions, referrals, and adjustments that cannot happen if the doctor does not know what the patient is experiencing. Problems that are manageable go unmanaged. Quality of life that could be improved stays diminished. And men carry the weight of these changes privately, often developing anxiety, depression, and relationship difficulties on top of the physical issues they were already navigating. Here is how to change that. Before your appointment, write down what you are experiencing specifically, not just your urinary symptoms, your sexual symptoms, any changes in erectile function, any changes in ejaculation, including changes in sensation, volume, timing, or pain, any changes in libido or sexual desire, any pain associated with sexual activity, any anxiety or avoidance that has developed around intimacy. Write these things down so that you have them available, even if the appointment feels rushed or the topic feels uncomfortable to raise in the moment. When you are with your doctor, be direct. You can say something like, "I want to talk about how this condition is affecting my sex life because that is an important part of my quality of life and I want to address it." You can say, "I have noticed changes in my sexual function since starting this medication, and I want to understand whether that is related and what options I have." You can say, "I am having pain during ejaculation and it is affecting my intimate relationship and I want help understanding and addressing it." These are complete, legitimate, medically relevant statements. A good doctor will engage with them seriously. If your doctor dismisses them without adequate response, that is important information about whether this doctor is the right partner for your care. Ask specific questions. Ask whether any of your current medications are known to affect sexual function and whether there are alternatives. Ask whether pelvic floor physical therapy is appropriate for your situation. Ask about medications for erectile dysfunction and whether they are safe and appropriate given your specific condition and any treatments you are receiving. Ask about referrals to a urologist who specializes in sexual function if your primary care physician does not feel equipped to address these issues comprehensively. Ask what timeline for recovery or improvement is realistic given your situation. If you are facing prostate cancer treatment decisions, ask specifically about the sexual function implications of each treatment option before making a decision. Ask about nerve-sparing surgical techniques and whether you are a candidate. Ask about penile rehabilitation programs that can support erectile function recovery after prostatectomy. Ask about timing and approach to erectile dysfunction treatment during and after radiation. Ask about the reversibility of androgen deprivation therapy effects on sexual function when that treatment eventually ends. These questions are not inappropriate. They are not secondary to your medical care. They are part of your medical care. Your quality of life, including your intimate life, is a legitimate medical priority. Now, let us talk about rebuilding intimacy after a prostate diagnosis or treatment, because this section matters not just to the man watching, but to the partnership he is part of. Prostate conditions and their treatments do not just affect the man. They affect the relationship. A partner who does not understand what their man is going through may misread his withdrawal, his avoidance of intimacy, or his changes in sexual function as rejection, loss of attraction, or emotional distance. Without honest communication, the medical experience of one partner becomes a relational wound for both. Open communication about what is happening physically, what has changed, what feels different, what is difficult, is the foundation of navigating prostate-related intimacy challenges together. This does not mean that every difficult detail needs to be shared immediately or that conversations will be easy. But the alternative, which is silence and assumption, consistently produces worse outcomes for both partners. Couples therapy or relationship counseling with a therapist who has experience in sexual health and chronic illness can be genuinely valuable when prostate conditions are affecting intimate relationships. This is not an admission of failure. It is an intelligent use of available support to navigate something genuinely difficult. Intimacy itself deserves to be redefined when physical changes have occurred. For many men and their partners, sexual intimacy has been largely synonymous with a specific physical sequence of activities. When prostate conditions alter that sequence, whether through erectile changes, ejaculatory changes, or pain, the entire framework of intimacy can feel disrupted. Expanding the definition of intimacy to include a broader range of physical closeness, emotional connection, sensual experience, and shared vulnerability allows couples to maintain and even deepen their connection through a medical experience that would otherwise create only distance. Sex therapy with a qualified therapist who specializes in sexual health can provide enormous practical and emotional guidance for couples navigating these changes. These professionals have specific training in helping individuals and couples adapt to sexual function changes caused by health conditions and their treatments. They provide concrete strategies, supportive frameworks, and the kind of expert guidance that neither a general practitioner nor a well-meaning partner can fully replicate. For men experiencing erectile dysfunction as a consequence of prostate conditions or their treatment, it is important to know that treatment options are available, and many of them are effective. Oral medications for erectile dysfunction are often the first line of treatment, and in some cases are effective even following prostate treatment. Vacuum erection devices, penile injection therapy, intraurethral medications, and penile prosthesis surgery are all options at different points in the treatment spectrum for men for whom oral medications are not sufficient or appropriate. Penile rehabilitation programs, which involve regular use of erectile aids beginning shortly after prostatectomy, have evidence supporting improved erectile function recovery over time. If you have had or are planning prostate surgery, ask your urologist specifically about penile rehabilitation and what approach they recommend for your situation. Testosterone replacement therapy may be a consideration for men with documented low testosterone affecting libido and sexual function. though its use in men with a history of prostate cancer is a nuanced medical question that requires careful discussion with a knowledgeable specialist. This is not a treatment to pursue without thorough conversation with your doctor about your specific history and risk profile. I want to close this video by speaking directly to the men watching this. You did not choose to have a prostate condition. You did not choose the ways it has affected your body, your sexual confidence, or your intimate relationships. And you do not have to simply accept the loss of those things without fighting for every tool and strategy that might help. Your sexual health is a real and legitimate part of your overall health. Your intimate relationships are a real and legitimate part of your quality of life. The changes that prostate conditions produce are real challenges, and they deserve real medical attention, real emotional support, and real practical strategies. The silence that surrounds this topic in men's health culture has caused genuine harm. It has kept men suffering privately with problems that are addressable. It has kept partners in the dark about what their loved ones are experiencing. And it has allowed quality of life to diminish unnecessarily for men who deserved better information and better support. You deserve better. And everything we have covered in this video, the understanding of how prostate conditions affect intimacy, the knowledge of what lifestyle factors matter, the clarity about pelvic floor health, the language to use with your doctor, the framework for rebuilding intimacy with a partner, all of it is available to you right now. Use it. Make the appointment, have the conversation, ask the questions, get the referrals, do the rehabilitation work, talk to your partner, find a therapist if that support would help. Because every one of those steps is a step toward a better quality of life than silent suffering allows. You are not defined by your prostate condition. You are a complete person who deserves complete care. And that care begins the moment you decide to stop carrying this alone. Thank you for watching this all the way through. If this gave you clarity, courage, or information that you needed, please share it with a man in your life who needs it too. Subscribe for more honest, medically grounded men's health content. And drop a comment below telling me what part of this video you found most valuable, because this community and this conversation matter enormously.